Bula Vinaka. Welcome to Sova Ni Bula Quick Reference Guide website version for SOPD Medical Officer. In this video, we will look at the following features: updating the patient queue, viewing examination results, entering clinical notes, entering medication and importing the medication list into the clinical plan, entering eye care, dental and nephropathy notes, and creating a referral form. To begin with, log into the Sova Ni Bula system and visit the reminder section to view the patient's appointments. To do this, click on the bell icon for reminder. This will redirect you to the appointments page. The appointments are categorized into 4 different categories. These are today's appointments, appointments due in a week, appointments due in a month, and those who have defaulted their appointments. You will also be able to see the date of the appointment, name of the patient, manual folder number, contact information, order of the patient queue, and the status of each patient's queue from here. Search through today's appointment list and select the patient for checkup according to the queue. From the behavior column, click on the person icon and wait for a few seconds to be redirected to the patient's information page. Step 1. Update the patient queue. Click on the MO title to update the queue. The orange color indicates that the patient is being seen by the doctor. From the Profiles tab, see patient's demographic details and contact information. Choose the History tab to view the patient's background medical history. Here you can view the summary, history, family history, social and occupational history, allergies, and past medical and surgical history. The next appointment date may be viewed from the right-hand panel. After completing the patient assessment, you may adjust the appointment date as required. Use the clock icon on the left-hand panel to access the calendar and select a new date. Step 2. Examination records. View the recent and past lab results. Click on Examination Record tab to view all lab results and vital signs entered. Filter records according to the test type for easier viewing. Click on All to reveal the drop-down list. Step 3. Clinical Note. Visit the Health Information tab to enter the clinical notes. These are given in the boxes underneath the various health information record features. Medical officers may enter the patient's complaints, clinical note or examination note, assessment, and the clinical plan. Enter all relevant clinical notes in the tabs given by clicking on the tab of your choice. Once you reach the clinical plan column, before saving the clinical note, scroll up to visit the medication tab. Step 4. When entering plan, visit the medication tab to view past prescriptions and to create new prescriptions. Then return to Health Information tab and import the newly created prescription as part of the clinical plan. Click on Create. Type in the medication name. As you enter a few letters, the corresponding medicine will appear in the drop-down list. Select the frequency and method from the drop-down list and enter the end date for the prescription. You may also type in the frequency or method for easier detection from the drop-down list. Repeat the medication steps as necessary until all prescriptions have been entered. As you enter one medication, the next option for the next medication will automatically appear. If you wish to prescribe a dosage that is not given on the list, you may select the medication and override the dosage, or you may type in the whole medication name with dosage without having to pick from the list. Once you have entered all the medication required by the patient, click OK to save the record. There is also a repeat prescription feature that allows you to duplicate the medications from the last visit if the patient's medication list and dosages have no changes. After digitally recording the prescription, please ensure to record the medication prescription manually for the patient to take to the dispensary. Step 5. Importing the medication into the clinical plan. After saving the medication prescription, return to the Health Information tab and import the medication prescription. Click at the end of the last note in the clinical plan, then click on Import Medication. The medication prescription will be updated in the clinical plan. You may remove the unnecessary spaces in between the plan and the medications. Then click Save Clinical Note. The clinical note will then get saved on the right-hand panel for the dietitian and physiotherapist to see and assess their patients accordingly. Next, we will look at Step 6, Referral Form. Click on the Referral Form tab. You may use this feature to refer the patient to another health center if required, whether due to relocation or for the transfer of serious cases to a divisional hospital. Click on Create. Enter the relevant information and click OK to save the record. Next, moving on to Step 7, return to Health Information tab and update the patient queue. Click on the MO title again to update the queue. The title color will change from orange to green, indicating that the checkup has been completed by the MO. Then return to the appointment reminders and repeat all the steps to start consultation for the next patient in the queue. Thank you for watching. Vinaka.